Warm welcome to the latest Onco Shorts podcast, brought to you by MedSynapse. Onco Shorts covers a wide range of clinical and scientific medical content that offers enriching insights into the world of oncology. In today's podcast episode, we will discuss details of a randomized phase 3 trial, titled Darolutamide and Survival in Metastatic, Hormone-Sensitive Prostate Cancer, featured in the February 2022 issue of the New England Journal of Medicine. Metastatic, hormone-sensitive prostate cancer differentiates from prostate cancer in the fact that these metastatic cancer patients have never received or are sensitive to androgen deprivation therapy, ADT. Standard treatment includes the addition of either docetaxel or an androgen receptor pathway inhibitor to ADT. Adding darolutamide to these patients greatly improves the outcome in these patients, rather than the application of ADT alone. This structurally distinct androgen receptor inhibitor greatly pairs up with ADT and aids in eliminating or reducing cancer growth. In this phase 3 trial, 1,306 patients were randomly assigned to receive darolutamide at a dose of 600 mg twice daily or matching placebo, both in combination with androgen deprivation therapy and docetaxel. Eligible patients were 18 years of age or older, had histologically or cytologically confirmed prostate cancer, and metastases detected on bone scanning, contrast-enhanced computed tomography, or magnetic resonance imaging. Patients were excluded if they had regional lymph node involvement only, or if they had received androgen deprivation therapy more than 12 weeks before randomization, second-generation androgen receptor pathway inhibitors, chemotherapy, or immunotherapy for prostate cancer before randomization, or radiotherapy within 2 weeks before randomization. The primary endpoint was considered to be overall survival, and the secondary endpoint was time to castration-resistant prostate cancer, time to pain progression, symptomatic skeletal event-free survival, time to a first symptomatic skeletal event, time to initiation of subsequent systemic antineoplastic therapy, time to worsening of disease-related physical symptoms, time to initiation of opioid treatment for 7 more consecutive days, and safety. Out of 1,306 patients, 651 were in the darolutamide group and 655 in the placebo group. The mortality risk was comparatively lower by 32.5% in the darolutamide group than in the placebo group. Thus, it proved greater overall survival in these patients. As per the secondary endpoints, the time to development of castration-resistant disease and time to pain progression was significantly longer in the darolutamide group. The hazard ratio for symptomatic skeletal event-free survival was 0.69, and it was 0.39 for darolutamide group in terms of the initiation of subsequent systemic antineoplastic therapy. There was not much significant difference in the two groups with respect to worst grade adverse events starting from grade 1 to grade 5. The frequency of death due to adverse events was low and similar in the two groups, which were 4.1% for darolutamide group and 4% for the placebo group. To conclude, overall survival was found to be longer in patients treated with the combination of darolutamide, androgen deprivation therapy, and docetaxel than in the placebo group. Considering the adverse effects, both the groups were on parallel lines. This ends today's Onco Shorts podcast, brought to you by MedSynapse. Thank you for listening.